We're back.
So King's like the Jay Leno.
yeah.
I don't know. I never know what I'm going to say till it comes out. I really don't.
So,
The
you have like a
size
signature?
robot assistant. He does.
I do?
He points to his eyes and says,
Yeah.
bye-bye.
Sweet.
Well, okay.
Sorry.
I'm already starting to cry. Hi, and welcome to Days of Our Eyes. We're back. I'm Dr. King.
And I'm Dr. Cha.
And today we're joined by Dr. Taylor Strange. He's our founder and chief surgeon at Alliance Vision Institute. So today we're going to be talking about AI and robotic assisted cataract surgeries. What is it? Why would you want it? And how can I get it? Stay tuned. We'll tell you. Dr. Strange, what is robotic assisted cataract surgery?
So robotic assisted cataract surgery has revolutionized how we do modern cataract surgery. In the past, we would do the whole surgical case manually, meaning we would just use blades to do the whole procedure with our phaco emulsification instrument to break up the cataract and take it out. Now we have the new Ally laser assisted robotic cataract surgery machine. So it's really cool. It's like a robot that docks onto the patient's eye, and it uses AI, artificial intelligence, overlay over the patient's eye and lines up their eye during the cataract surgery to perfectly correct the astigmatism to their eye, which is the shape of the cornea. And it also breaks up the cataract into detail with laser guidance, which allows for patients to have faster visual recovery, and it's safer and it's extremely accurate as far as correcting the astigmatism. And we do that here at Alliance Vision Institute for all of our premium packages because we want to get that perfect outcome to eliminate the patient's need for prescription glasses after cataract surgery. Depending on what package level we go to, there's different levels where we're maybe just correcting the distance, where the patient will still need readers for intermediate and near range, or we have kind of a good intermediate package where the distance and intermediate range is corrected. And then the full range of vision package, there's two options with the new Johnson & Johnson Odyssey multifocal lens, which will correct patients for all full range of vision, and the new light adjustable lens technology, which can also get patients glasses independence. And that's one that we adjust in. But we're talking about robotics, that's what we're allowed to do now, overlaying with those premium options for patients to get them to the best visual outcome possible.
Yeah. Awesome. I think, we see the patients afterwards.
We do.
And I can notice how much quicker their vision's coming back and how much quicker the recovery is. And when we're going after astigmatism and whatnot, with that AI overlay, it's much more precise. So they're healing faster and enjoying sharper vision with, just by allowing us to be more accurate in lens placement. It's been pretty amazing just seeing the evolution over our careers.
And one more feature I left off, I want to mention, it does perfect centration of the IOL.
I was just about to say, yeah.
Which, as you know, is very important, especially when you have a multifocal lens or a toric lens. You want it lined up just perfectly inside the eye, and it just doesn't get better than with the robot doing it. A lot of surgeons are really good with manual.
Like yourself, honestly.
Well, hey, thank you. But I can still not beat the robot when it comes to lens placement.
Right.
It takes it down to the finest micron detail.
So, and what I like about it is it's able to focus on the visual axis versus center of the pupil. A lot of people don't understand that the center of the pupil is not necessarily exactly the visual axis. But by using the technologies we use today in pre-cataract surgery, and then the LensR system talking to our measurements, it can read our measurements, and we actually can get right on the visual axis. And that's where we get this. We talk about improved accuracy and improved visual outcomes.
Right.
Because we're just more precise.
Right.
Correct. Yeah, and that diagnostic equipment we do in the lane, the nice thing is it talks to the robot via the cloud. So all the imaging is sent from the clinic's preoperative examination, sent to the robotic laser, and then when the patient lays down under it, it perfectly lines up the patient under the machine.
Yeah.
So I don't have to mark the patient preoperatively. I used to have to do that when we were doing things just manual.
Right.
And so it's a time-saving thing. It's a better experience for the patient when they're
Right,
at
right.
the surgery center.
Right.
And that was those purple marks, right?
Yeah. Like
Okay.
the ink that you would put on like the eye to help make sure we're all on the same page, like going with what we're planning.
So who do you guys think is a good candidate for this type of surgery?
Well, like Dr. Strange said, this is modern cataract. This is the modern version of cataract surgery. Really, we recommend it for everybody. I don't, and correct me if I'm wrong, I don't think anybody's disqualified from the laser option. It is because it is our preferred method of cataract surgery.
It's true. Yeah. Even if we're just targeting just distance vision, it's better to have that laser guidance there to correct the astigmatism the patient has. And also, especially some of these dense lenses that we see, it's good to have the laser robotic fragment that for us basically break it up via lasers. And so everyone is a candidate with very rare exceptions.
Right.
Yeah, when we talk about breaking up the cataract, the lens is dense, and the older way of doing it is we actually used a little machine that phacoemulsified it.
Like a
that
jackhammer.
creates like a jackhammer. That creates more energy inside the eye. With using the laser to break it up, we're not getting as much energy dispersed through the eye, which makes the eye get less angry. We're already in there messing with it. We don't want to make it any more mad than we have to. So the laser is actually a little gentler on the eye, in my opinion, when I see the post-ops, than when we have to use the phaco machine.
Yeah, that's what I was going to ask you guys. I mean, you see the corneas manual versus laser. What's been your experience over the years?
Much quicker. I remember when we switched to the laser, I walked in the first day and I looked at you and I said, I can't believe these corneas.
Yeah.
They're so much clearer. So patients are they all get there. It's not like you're not going to get clearer the other way, but the patients were enjoying their vision, the day after surgery versus having to wait a few days for a lot of that swelling to clear, especially on the more dense cataracts.
Right. Yeah, I usually tee up my patients, after cataract surgery, especially the traditional route, right? Expect your vision to be very blurry. I mean, if you can't count your fingers afterward, that's normal because that's how much work that needs to, but how much elbow grease needs to go in to do it by hand, so to speak. But with the ally laser, with the precision of the laser and with the algorithms and the robotics that help guide Dr. Strange to be able to be as precise as possible, that translates to more immediate visual recovery and also long-term visual precision, I believe, as well.
Right.
Yeah. But, a question, Dr. Strange, so we do this whole hour-long workup to get all these calculations. You say you put it into this, this computer that does it. Do you just press a button and walk away and does it for you? Or how does it...
Actually, one of our technicians does that.
Okay, gotcha. But so, do you just is a patient laying on the table and you're not even in the room with them? How does it how do you implement it into your actual surgery?
Yeah, that's a great question. So the scans go via cloud to the actual robotic laser in the surgery center, and then one of our technicians pulls up the patient's file. And what's really cool is you can see the Pinicam iris and cornea imaging. The robotic laser takes that image, and when the patient is docked underneath the laser, it knows the different iris landmarks on the patient and where the steep and flat axis of their astigmatism is to correct it. And it'll even adjust to any kind of micro movements or what we call cyclotorsion. Basically, when you lie down and your eye moves one way or the other, which is pretty common actually, the laser knows that via the iris landmarks that it needs to shift, which keeps it on the perfect axis in order to get that neutral outcome for their vision, for the prescription.
Right.
So it's all done. The technician pulls it up. I dock the patient. The robot knows that patient's iris based on the image. And it lines it up perfectly,
cool. Yeah.
And then I just fire away.
Gotcha. So yeah, no, Dr. Strange is not, delegating the procedure to like
We're not pressing a button and leaving the room.
there's a robot that's walking in the room.
Maybe in a few years.
Yeah, Doctor Strange's expertise and skill is still very intimately part of the procedure. But we are utilizing technology at its highest degree that that is safe and
Assisting.
proven. Yes.
It's assisting me and other surgeons that use this technology throughout that cataract surgery case or lens exchange cases.
Right.
So,
Yes, sir.
Yeah, it's assisted.
So when do we all think patients should start considering cataract surgery for themselves or their loved ones?
Yeah.
Yeah, what I usually tell patients, they always ask me, is my cataract ready, right? And I think my colleagues would agree, it's the $1 million question. You can't time it for anyone. It really is patient dependent. And usually there is a wide range of when you're ready for a procedure. One, you want to make sure that you are getting seen by a professional who knows what options are available and hopefully can provide a breadth of options, not just one size fits all like hammer, so to speak. And then once you understand your options, let's say a lens exchange procedure or maybe to the point of cataract procedure is necessary or recommended. Well, if you're looking for a refractive or visual correction outcome and the lens exchange procedure is recommended, I mean, that's the way to go, right? Usually our patients that are cataract age, so to speak, into their sixth or so decade, that's the prime age and that's when most patients get it. I believe you told me a statistic, right? Usually by the seventh decade, most Americans have already had cataract surgery. Is that right?
Yes. Over 80%.
Yeah, it's vast majority. So if your grandparents or whatever haven't gotten it yet, tell them to get on get with the times and let them know that we have a great option that they might be afraid of like what their grandparents got, stuck with the Coke bottle glasses. That's just not what modern cataract surgery is anymore.
No, and the thing that it sneaks up on you. Cataracts slowly develop, so a lot of people kind of adapt to the changes in their vision. So if you have loved ones who are kind of giving up some of their activities that we can't come over, it's going to be dark before we come home, and I don't like to drive in the dark, that's not normal. You may want that may be a red flag, or they've got every light in the house on to read because they need more light constantly.
Right.
That's can be a sign that there's something going on.
Yeah, and what I see most too is driving seems to be the number one visual complaint for patients that typically brings them in for a cataract evaluation. It's that night driving, oncoming traffic, the starbursting off the light, the car lights is pretty much up there, or number 1 or 2 as far as visual complaints for patients with visually significant cataracts. A lot of patients, we all start cataracts typically maybe in their late 40s, 50s. It's a very slow, gradual process for most people over a couple of decades. Then when you start getting more into your 60s, mid to late 60s, then you kind of cross that threshold where typically night vision and the activities that you guys have mentioned start to get to patients where they fall off a cliff basically with their vision. And then that's what brings them typically into cataract surgery at that time.
For sure.
Where can patients find more information about AI and robotic assisted cataract surgery?
Yeah, great question. I mean, you can go to our website. It's allianceeyes.com. You can also Google us at Alliance Vision Institute as well and find us that way. You can book online. We have a portal that you can go on your own cell phone and click the book online button, and you can select whether that's a LASIK eval, cataract eval, and other options there for you, and see our scheduling. And you can also call the office. The phone number is very easy. It's 817-442-2020. So
Good.
who would have thought, right?
No, hey, y'all did a good
Well,
job.
our doctor doesn't have 2020. So if you're interested in finding out more about what you heard, click on the link that's found in the description. And just FYI, I've actually had robot assisted surgery on my own eyes, and let me tell you, it made it a breeze. And you just see some pretty colors. That's all you see. So we're glad to be back. Welcome back to Days of Our Eyes. If you like what you heard today, please click on the subscribe button down below. And we're looking forward to seeing you next time. In the meantime, I'm Dr. King.
I'm Dr. Cha.
Dr. Strange?
Have a great day.